trauma release exercises you can do right now. This is written by Karyn Mitchel in Modern Neurocounseling. When a person has trauma, the first thing they consider is seeing a therapist. This can be an incredible source of healing for many people, but for many others it may not help at all. This is because trauma affects not only your mind and emotions, but also your body. For some people, the only way to free themselves of trauma is to release it from their body. This is where trauma release exercises come into play. What are trauma release exercises? Created by trauma specialist Dr. David Berselli, trauma release exercises are physical exercises that can help you release stress, tension, anxiety, and trauma physically. Practicing trauma release exercises can help you calm your nervous system down, which can normally be incredibly difficult to do for someone with trauma or severe anxiety. This is revolutionary because you do not need to have conscious control of your body-brain in order to use these techniques. Many people do not recommend mindfulness meditation for those with PTSD because it can cause painful memories to come up and create panic. However, with TRE, the simple practice of stretching and moving your body can move the tension out and replace it with relaxation. How do trauma release exercises work? Even if you don't have trauma, stress and anxiety are natural responses to daily life that get stored in the body. Your body responds to these stressors by contracting your muscles to push through the problem. It's not until we feel pain, discomfort, or illness that we notice these constant contractions. Trauma release exercises work by activating what is known as the shaking mechanism, which causes muscles to relax. Relaxing tense muscle patterns can reduce physical stress in the neck, shoulders, spine, and pelvis. Anytime tension is released, the brain registers a reduction in pain signals and produces new hormones that promote healing. What conditions can trauma release exercises help with? It can help with the following issues: sleeplessness and insomnia, trauma and PTSD, anxiety, everyday stress, emotional fatigue, which tends to come up a lot in helping roles, like being a teacher or therapist, burnout, chronic illness, sports recovery. Here's some trauma release exercises. Exercise 1, ankle stretch. Roll your feet to the sides so that you're balancing on the left or right side of each foot. Roll back and forth on each side and repeat 7 to 8 times per side. This is rolling the feet to the side so that you're balancing on the left or right side of each foot. Rolling back and forth on each side. Repeating 7 to 8 times per side. And then shaking out each foot and ankle for a few seconds. Exercise 2, calf stretch. Step right foot back so that the weight is on the left foot. Lift the front heel off the ground. When your calf muscle feels somewhat fatigued, a 7 on a scale of 0 to 10, stop. And shake out your left leg for a few seconds. Repeat until your right calf is fatigued, then shake out your right leg. So we're stepping the right foot back so the weight's on the left foot. Lifting the front heel off the ground. When the calf muscle feels somewhat fatigued, a 7 on a scale of 0 to 10, we stop. Then we shake out the left leg for a few seconds and repeat on the right side until the right calf is fatigued. then shaking out your right leg. Exercise 3. Thigh and hip stretch. Step the right foot back so that your weight is on your left leg. Lower your hips slightly as if about to sit down in a chair, and this will cause a bend in the front leg. Without letting your knee bend beyond the tip of your toes, repeat this motion until you feel fatigued. When your fatigue level is at a 7 out of 10, we shake out the left leg. So we're stepping the right foot back so the weight is on the left leg. Lowering the hips slightly as if to sit down in a chair, causing a bend in the front leg. Without letting your knee bend beyond the tip of the toes, repeating this motion until you feel fatigued. And when the fatigue is at a level 7 out of 10, we stop and shake out the left leg. And then repeat on the right leg by stepping the left foot back, lowering the hips slightly as if to sit down in a chair, causing a bend in the front leg. Without letting the knee bend beyond the tip of the toes, repeating this motion until you feel fatigued at a level 7 out of 10. Stopping and shaking out your left leg. Exercise 4. Inner legs, hips, and back. Stand with your feet apart at a comfortable width so that you feel balanced. Folding forward, bending the knees, and sending your hands toward the ground. Relaxing your neck and taking 3 deep breaths. And walking your hands to your right leg, where you can either keep your hands on the floor or hold on to your leg. Taking 3 more deep breaths. And then walking your hands over to the other leg. And repeating 3 more breaths. Then walking the hands back to center, and if possible, back through your legs slightly. Taking 3 more breaths in this position. Returning to an upright position and shaking out your legs and hips. Exercise 5. Opening the front of the body. Place your feet wider than hip width apart. Place your hands on your hips or low back, whichever is more comfortable. Bend your knees slightly, bow your back, and push your hips forward gently. Taking 3 breaths. Rotate the spine to look towards your left elbow and taking 3 breaths. Rotating to the right and taking 3 breaths. And then finally returning to center and taking 3 more breaths. Return to upright and shake it out. Exercise 6. Wall sits. Rest your back against a wall and slide down slightly, bending the knees. Your feet should be about hip width apart, and you should be able to see your toes. This should be less difficult than a normal wall sit, about a 5 on a scale of 1 to 10. Adjust accordingly if needed. As your fatigue increases, move up slightly to return to a 5. Stay on the wall for 3 to 5 minutes, adjusting regularly to stay comfortable. Tremors may come. This is normal. If they make you uncomfortable, you may come off the wall and then return to it. When you are done, push off the wall with your hands to come back to a standing position. So you're resting your back against a wall and sliding down slightly, bending the knees. Your feet should be about hip width apart, and you should be able to see your toes. This should be less difficult than a normal wall sit, about a 5 on a scale of 0 to 10. Adjust accordingly if needed. As your fatigue increases, move up slightly to return to a 5. Staying on the wall for 3 to 5 minutes, adjusting regularly to stay comfortable. The tremors may come, and this is normal, but if they make you uncomfortable, you may come off the wall and then return to it. When you're done, push off the wall with your hands to come to a standing position. Allow yourself to fold forward, hanging or with fingers on the floor, relaxing your neck. Shaking is also common in this position. Hold here for 1 minute. Bring your hands onto your legs and lift from your hips to return to standing. Exercise 7, floor sequence. Lay on the floor, a yoga mat, or a bed on your back, with arms to your sides and palms down. With knees bent and feet on the floor, move to the first rest position. To do this, bring the soles of your feet together and open your knees. The stop position is laying your legs flat on the floor with toes pointed back towards your head. You can stop at any point during this trauma release exercise if you are uncomfortable. With the knees bent, feet on the floor, move to the first rest position. To do this, bring the soles of the feet together and open the knees. From here, we lift the hips an inch or two. If you're not able to engage your muscles as though you're lifting, hold for up to a minute, then bring the hips down. So we're lifting the hips an inch or two. And if you're not able to, you just engage your muscles as though you're lifting. Holding for up to a minute, then bringing the hips down. From the rest position, bring your knees together 1 inch at a time and hold for up to 2 minutes. Repeat 3 times. Allow the tremor mechanism to build. Next, put feet flat on the floor and move them slightly further away from the body. Your feet should be spread, but your knees should be touching. This is rest position 2. From rest position 2, lift the hips for up to a minute. The knees may come slightly apart. We're putting the feet flat on the floor and moving them further away from the body. The feet should be spread, but your knees should be touching. From the rest position 2, we're lifting the hips for up to a minute. The knees may come slightly apart. Bring the hips down and rest. Bring the feet together and allow the knees to open, 1 inch at a time. Each time you open 1 inch, hold for 2 minutes. Once the body begins to tremor, you may return to rest position 1 or 2, move to stop position, or hold the position. You have your choice. Once the body begins to tremor, you can return to either rest position, to a stop position, or continue to hold the position. Move the feet away from each other and remain in this position, tremoring for 5 to 10 minutes. When completed, roll to your left side, pushing yourself into a seated position, and breathe, allowing things to integrate. Frequently asked questions about TRE. Can I do TRE alone? Yes, you can learn trauma release exercises and perform them alone in your home. However, it should be noted that if you're using TRE to support mild, moderate, or severe trauma, PTSD, it is recommended that you work with a TRE trained professional who can guide you safely through techniques. How is this used therapeutically? Symptoms like anger, anxiety, stress, and trauma can become difficult to manage or even overwhelming. Using TRE in a therapeutic context allows the therapist to use the body as a part of the therapy. These exercises are part of the stress reduction, allowing those overwhelming feelings to reduce to the point that other coping skills can be used. What is the best way to learn TRE? To learn more about trauma-releasing exercises, you can visit Dr. David Berselli's website, traumaprevention.com. He has books, videos, and more about TRE so you can guide yourself through the techniques. How much time is needed to do TRE? Dr. Berselli recommends about 15 minutes of shaking tremors per session, but it may take some time to work up to that depending on your comfort level. Some people find the process enjoyable and remain in a tremor state for longer than 15 minutes, and some are even able to activate the release without the full exercise process. How often should I practice TRE? Once you're comfortable with the movements, it's recommended that you practice at least twice a week, up to every day, depending on your preference. What do shaking or tremors mean? Tremors come when you hold a position or move your body in certain ways. You will know them when you feel them. They can also come in strong or gentle ways. A strong tremor indicates that large muscles are breaking up iceberg-like tension. These blockages will create strong tremors until they are broken up. Note that the intensity may ebb and flow, and there's no need to get caught up in what intensity your tremors are occurring at. These exercises cause emotions to surface sometimes. These exercises are meant to relax tightly held muscles, and when they finally relax, bruised emotions can come up for some people during deep relaxation of the muscles. Some people report no deep emotional feelings and just experience a physical shaking. The body will do what it needs to do. If you begin to feel intense emotions during trauma release exercises, do what comes naturally. You may return to the stop position, curl up in a ball, walk around, eat, or do anything that you feel an urge to do. Ensure that you are comfortable. It may be helpful to employ grounding techniques like engaging your 5 senses or looking around the room you're in. Final thoughts. If you struggle with trauma and find that traditional talk therapy doesn't help, then something like trauma release exercises or somatic experiencing may be incredibly helpful. At Modern Era Counseling, they have somatic experience therapists that can help you start to move the tension out of the body.